morning. How are you?
Good, how are you?
Good. My name's Jamie. I'm going to be your nurse today. Can I have your name and date of birth for me?
10/9/11/1940.
Perfect. How are you feeling this morning?
Okay.
I'm just going to recheck your blood pressure because they took your vital signs so it was a little low. So I'm going to do that. Okay. And excuse me. Your blood pressure is still low. It was 90 over. Give me a second. They checked it earlier. Oh. It was 90 over 62, so I'm going to hold your beta blocker, which is just your atenolol. Have you been taking that for a while? So you know what that is. Okay. Besides the fever, do you have any other complaints? Because I saw that your temperature is high. And we're going to get you something for that.
Just a little chilly.
Chilly? Do you want blankets?
Yeah.
Okay.
Ah,
Is that better?
lovely.
Okay. So I'm just going to give you, wait, before I ask, do you have any allergies?
I have a sulfur allergy.
Okay, because I saw on here that you were given an antibiotic, a sulfa one, and they can't give that to you, so I will call and then I'm going to give you Cyabalmin, which is just a B12 injection, and then I'm going to give you your inhaler, and then I'm going to give you some fluids for your fever, and that'll go through your IV, so then we'll check that. And then I'm going to give you your insulin, and then I saw that your blood sugar was 242, so I'm going to give you an extra 4 units of your insulin aspart. And you take that with meals, and you've already ordered breakfast, correct? Perfect. And then, like I said, I'm going to give you acetaminophen, and so I'm going to get that started for you, okay? So I'll be right back. Okay. First, I'm going to grab alcohol, swabs, cup for medicine. Then I'm going to grab acetaminophen, and she was ordered 650 milligrams, and this is acetaminophen 650 milligrams. And then I'm going to pick it up and grab the inhaler, and I'm going to make sure it's the right one. Yep. And then we're holding the beta blocker, and then I'm going to get the B12 supplement. That one's low. Grab the other file that's in here. And the order is for 1,000 micrograms, and we only have 500 micrograms per milliliter. So I will give her 2 milliliters for her injection. And then I'm going to grab her insulin. So insulin Aspart or Novolog. Then I'm going to grab insulin injection needle and make sure, so she gets 16, and this one goes up to 50 units, so this is good. And then I'm going to grab the 3 milliliter because the injection for the B12 is 2 milliliters, so this will do fine. I'm going to grab the saline for IV flush. I'm going to go over here, grab my tube, and then grab some IV fluid. We're going to put that all over here. And then we're going to go back to the patient's room. You're going to sit in the tray. Hello. The back of your medication. So before we get started, can you tell me your name and date of birth?
M91140.
I'm just going to scan your bracelet. Beep. And then I'm going to use your fluids first. Have you had any pain around your IV site? Okay. And then I'm going to scan. Let me get the fluid out. I'm gonna move the trash can next to the bed. Beep. And then I'm just gonna beep, scan the saline because it's going on the IV. Okay. Now I am going to put on gloves. And I'm just gonna get your IV all ready, okay? Yep. So this with the acetaminophen should make your fever go down. I'm gonna get all my tubing out. Okay. And the IV bag is spiked. And I'm going to blow some bubbles in. Make sure to get the chamber full. Not all the way full, but enough fluid in there. And then I'm going to prime the IV. And clamp it. Put the cap back on. And I'm going to set this right here. And then I'm going to grab an alcohol swab. Okay, can I see your IV? And then I'm going to scrub the hub. I'm going to scrub this. I'm going to scrub this. Thank you. And then I'm going to put this right here. Like this. Then I'm going to get the saline out while holding the IV. And then it said to flush it for 3 milliliters. So I'm going, and this one has 10. So I'm just going to flush it until there is 7 milliliters left. Okay, so after scrubbing the hub, I am going to put 3 milliliters of saline in here into her IV. And there's 10 milliliters in here, so I'll just go until there's 7. And make sure that the IV is not clamped. And I will attach the IV I just primed. And then put this in the sharps. And then I will unclamp and let it run. Okay. And then I'm going to change my gloves for her IM injections. But first I'm going to give her acetaminophen. Do you want to take, are you okay taking it with water?
Yeah.
And I'm just going to double check the dose before I scan it. So the order is acetaminophen, 650 milligrams every 4 to 6 hours. And this is acetaminophen, 650 milligrams. Beep. Can you take this for me? And here's water.
Delicious.
Yep. Okay, and I'm going to start her IM injections. I'm going to start with the insulin. Where was the last time you had, or your last place you had your insulin shot? Do you remember?
My right abdomen.
Your right abdomen. Do you care if we do it on the left side of your stomach? Okay. And for, I'm going to wipe. So this would be the left side of your stomach. And for subcut injections, you want to do the fatty parts. So the stomach, like the love handles, and you could do the bottom, but it's not common. So the order is for 12 milliliters plus the 4, so that'd be 16. So I'm going to draw up 16. And then push it into this. Well, I'm going to clean this first. And then push the air in. I'm going to turn it upside down. And then draw back 16. And then I'd have a nurse check it and ready cleaned her. So for subcut, you pinch and go in and go out, and then sharps. Then going to do B12, and since this is an IM injection, I can't do it in her deltoid because it's over 1 milliliter. Is 2, so I'm going to give it in her vastus lateralis, which is just the side of her leg. So I'm going to clean, pull up 2, push in, pull up, 2, okay, and I already wiped her. And then for IM injections, you spread and go in, push, hold it, and pull it out, engage the needle guard, put it away. And then for any of these medications, your side effects will more than likely be like dizziness, nausea, vomiting, diarrhea, and if you have any of those, just let me know. Okay. And then put on your inhaler. So For your inhaler, I'm going to have you shake it, breathe out, and then take a breath in, and then hold that breath for 10 seconds, and then we're going to repeat it. You shake it, breathe out, now breathe in, while inhaling, and then hold it for 10 seconds. Now breathe out. Now we're just going to wait a minute before we do the next round. Okay, and then I'm going to have you breathe out, and then put the inhaler in and breathe in. Hold it. Breathe out. Good. Okay. Is there anything else you need before I go? Okay. And then I would do hand hygiene and then document all her medications were given. And yeah.